There's a tremendous amount of research being conducted on all frontiers of oncology, research that offers cancer patients optimal treatments and prognosis for their cancers. We asked Dr. Elber-Camacho, Medical Director of the Comprehensive Cancer Center in Palm Springs, the success rate of early detection and treatment of these cancers.
The major symptoms of patients with malignant tumors of the blood are those related to the decrease in the major components of the blood. So if patients develop low white count, they can start having new infections. If their red cells become low, they feel tired and fatigued. If the platelets are low, then they can have bleeding, either from gums or nosebleeds. So those are usually the presentations of the blood disorders in which there is some component of anemia, of bleeding, or infection, and in the case of multiple myeloma, in pain of the bones. Even though all these tumors are serious, the good news today is that there's a potential for cure in the majority of these disorders. And the fact that there's a potential for cure, it is so important that patients get the newest and most advanced treatment, especially with the new agents that revolutionize the care of these malignancies and are making the treatment so much more effective. The new agents in the care of blood malignancies are those what we call targeted therapies. These are therapies that go directly to the tumor. Therefore, they have less toxicity and more specific for the care of the different malignancies. In regards to the target therapies to the surface of the cell, the first agent is called Rituxan, and this is used in most of the lymphomas, and it has been highly effective by itself or in combination with chemotherapy, and has made chemotherapy more effective in curing the diseases. In chronic lymphocytic leukemia, a new targeted therapy has been just approved this year, which again will help the control of this disease called chronic lymphocytic leukemia. In chronic myelogenous leukemia, another one of the leukemias, the target is different. It's a target that's an enzyme, a protein inside the cell that is blocked by a medication called Gleevec. And this has been highly effective. And the chronic myelogenous leukemia is now highly treatable, and the patients have shown very much longer, greater than 10-year survival with this medication. The second generation of this medication has already come out also, so patients who even failed the first-line therapy can now be treated with second-line therapy. Again, a targeted therapy that has no side effects of chemotherapy, and used by itself, just a pill, is able to control this previously incurable and highly malignant disorder. So in the future, I see the development of better targeted therapies in combination with chemotherapies that are again more effective and have less toxicity. And in that way, by the use of both agents, we will be able to eradicate many of these disorders.